Hello, everybody. Assalamu alaikum wa rahmatullahi wa barakatuhu. It's such a pleasure to be here in the United Arab Emirates with all of my colleagues from Geneva, from the networks, from the organizations. And again, I think my presentation will be a little bit more focused on what's happening in the Eastern Mediterranean region and how does it link to the amazing presentations that you have just all heard about. I think the COVID pandemic was a huge problem. And even for the simplest products, the reality for the patients, for the health workforce, that they were not able to access a simple mask, alcohol hand rub, and gloves. And that led to people dying. Now, 3 years after the COVID-19 vaccine was rolled out, great discrepancies continued. And we can see from within our region, even people receiving their first dose of vaccine was close to 10%, while around the world in some of the manufacturing countries, they were already receiving their third, fourth vaccine. That is again the reality of what was taking place and the reality of the significant discrepancy that was ongoing. Now, there's an urgent need to improve access. You've all heard about all of the different initiatives, the different collaborations, and the different ambitions on how to make this a reality. But it's not an easy task. So everything that we heard this morning requires the significant networking that's going to take place today throughout the meetings, and again, when you all go home to speak about the issue of access. Globally, we know that 2 billion people lack access to the essential medicines. The essential medicines list that is produced by the WHO and the medical products. We also know that in the Eastern Mediterranean region, half of the essential low-cost medicines are missing from the public health sector. And that is very, very important. This means that millions are left with only two choices. Either they're going to pay exuberant amount of money for out-of-pocket expenditure, and they're going to then deny the rest of their family and loved ones of resources, or they're going to go without these medications and suffer the consequences of disease, illness, and death. So the widespread lack of first and second line therapies, whether it's for cancer, cardiovascular diseases, is also lacking in the primary healthcare clinics. There's another thing that was not maybe mentioned so much in all of the previous discussions. There's an issue of substandard and falsified medications. In 2024 alone, 567 substandard and falsified medical products were reported in the Eastern Mediterranean region. That is a disaster for me. It's a jeopardy, and we're jeopardizing patient care. Now, you've heard from the different speakers the different stops. How do we serve the issue of access? In order for a medication to be produced, we need research and development. We need preclinical and clinical research. We need manufacturing. We need upscaling of the manufacturing. We need to procure, which means we need funding, and we need to store, which means we need warehouses, and we need to distribute, and we need prescription, and we need physicians and healthcare workers and pharmacists to be able to do all of that. Each one of these bubbles requires significant amount of work and significant amount of partnership. So in order to achieve our aim, which is a very clear one, it's affordable. We want people to be able to access it timely and the right time so they don't get it too late. And it has to be safe, effective, and quality. And this is the best forum to discuss all of these issues. Research and development within the Eastern Mediterranean region and within the bigger WHO family, we created the networks for the researchers and for making sure that the clinical trials are actually taking place in the most robust fashion. We were able to establish living guidelines on the COVID treatment during the COVID pandemic. But what is most important about the research entities, and I know today we have academicians, we have scientists, it's that we need the research and scientists to understand the importance of implementation research, but also research based on public health information, so that the research can support the public health needs of the communities. The second thing is that we need good manufacturing products. And this is, again, through this forum, I hope that we can further speak about how is this region, from the region to the region, and with its closest neighboring regions, Afro and Sierra, work together to make sure that the GMP based on the products of the WHO are ensured and continue to be supervised and available. We also need, and this is one of the biggest topics closest to my heart, we need proper functioning national regulatory authorities. And as you know, the WHO leads on the maturation assessments and the benchmarking through the benchmarking tool. And we have created a very robust flagship on that, which I will be talking a bit later. And we also work very closely with our member states on the pre-qualification of vaccines and medical products. Now, again, we need good storage and distribution practices, because if a medication, if a vaccine is not stored and saved in the right environment and the right temperature without humidity, then we will not be able to provide the proper medications. Then again, there's a huge responsibility on treatment guidelines, training of the healthcare workforce to ensure that the medicines that need prescription are prescribed, that we do not, I don't know how we're dealing with internet purchasing of medication these days, and ensuring also the quality of medications through the different ways of accessing it. And then, of course, there's the awareness of the consumer, him or herself, on ensuring that there's no off-record sharing of medications and prescribing by lay people. Lower prices of medicines needs to be a big topic that we need to discuss on ways. You've heard different entities and agencies talked about pooled procurement processes. Now, countries, we've all heard this, countries need to be self-sufficient. What happened during the pandemic and what's happening today, even on less obvious diseases, is that people cannot have access. They're not able to access their insulin, their first-line antihypertensives. And countries want to be self-sufficient. Regions want to be self-sufficient. Repetition of what happened during the pandemic should not happen again. But I've lived my whole career dealing with outbreaks and emerging and re-emerging pathogens. And I hate to say that we're still not learning the lessons. We're still falling in the same trap over and over again. And I think this is the time where also you heard the DG talking about the pandemic treaty, which touches on some of these areas on equity. I hope that this time we can get it right. So from insights into actions to the region, in the beginning of my term in February, I launched the Access Initiative on access, expanding equitable access to medical products. And in the Regional Committee 71 last October, all 22 member states have approved, endorsed, and blessed the plan. Now, we have identified the major bottlenecks for the region that the WHO either is responsible for, or leads on, or has the convening power to make it happen. And we will do everything we can to ensure that we make this access initiative a reality for it to solve the problems. How are we working with all of you on this issue? Assessing the local production capacity. We talk about the number of manufacturing companies. We talk about the billions of dollars that are spent. But what the regional office wants to do in EMRO, we want to make sure that we have a clear mapping of the production. And we've already started doing that, knowing who is producing what with which quantity. The quality part needs to be reassured to the NRAs, and I'll talk about that. But that type of understanding of the molecules that are being produced, the diversification of the molecules becomes important so that we actually complement each other and do not compete with each other unnecessarily. Establishing and strengthening regulatory authorities goes without a say. It is the responsibility of the countries that are producing the products to ensure that those products are of good quality, they are safe, and they are effective, and they have the mechanisms to ensure that the market is actually secure for the patients to purchase from. Now, in the regulatory authorities, we created an ambitious program or a vision for having more member states with an NRA level of 3 and 4. And also those who do not have a national regulatory authority, we need to help them establish one to at least ensure that they are capable of identifying substandard falsified medications. We already have one ML4 NRA in Saudi Arabia, one ML3 NRA in Egypt. We have 6 more NRAs in 6 different countries moving towards achieving their ML3. We also have the WHO substandard falsified network initiated to counter the substandard and falsified medications, as it is extremely crucial if we want to make sure that patients remain safe. We would also, setting up a pooled procurement mechanism. We have identified too many stockouts, and it's already time to ensure that we have the partnership with a, which is the AMRO, one of the 6 regions of the WHO, and they have been leading in this area quite for a long time. We have signed an MOU with them, and we will be working even closer to ensure that our pooled procurement process serves the needs of our member states, not only in the fancy and the newest of the vaccines, but in the basics of what is needed from the major diseases such as hypertension, diabetes, infections, and also cancers. We have also, in strengthening the local vaccine production capacity, we have released a regional strategy to strengthen local vaccine production, and that has also been fully endorsed by our regional committee. Going to a topic also that was not mentioned very much, we've also been thinking about what is the best way to ensure the delivery of such products. And we've already been working, and that's part of our strategy on access, is to ensure that they have the appropriate warehouses. These warehouses need to be digitalized. They need to have the best way of connecting to the other hubs within a national level, also within the sub-regional level, and then at the regional level. We're very proud and very thankful for the United Arab Emirates for hosting the Dubai hub. Only this week we have been supporting Myanmar with significant amounts of emergency kits. Over the past year of 2024, we have supplied millions worth of dollars to at least 76 countries. Their storage includes emergency kits, but also non-communicable disease kits. And through the Access Initiative, we're going to enhance line purchasing and line treatments to ensure that they are reaching the warehouses at the national, subnational level, reaching the primary healthcare clinics, secondary and tertiary hospitals, so that patients can have the access without delay in effective, quality insured medications and medical products. This is a picture of me in Jordan last 2 weeks ago or so. There was a refurbishment of 4 of their warehouses. We're working with them also to ensure the digitalization of that process. We're looking at countries from the region, specifically within the Kingdom of Saudi Arabia through NEPCO, the United Arab Emirates, Qatar, and Egypt, and a few others. I will be having a visit to Tunisia soon, followed by Morocco, to also look at the possibility, and I'm very happy to see the minister here of Tunisia and other minister lines to ensure that we continue to talk about the need to increase the warehouse capacity, but also the quality of the warehouses and their ability to talk to each other so that the stockouts become less and less. Now, to my last slide, going back to my safe zone as a clinician, as a doctor in my previous life, it is very important in improving patient care and medication safety. And these are usually healthcare-based projects or entities to ensure that the doctors, the pharmacists, and the communities are educated and aware of how to prescribe, when to prescribe medications, because even if they're available and we're abusing them or misusing them, we can still cause harm. So this was a very short snapshot of what we're trying to do in the region. The excellencies, the ministers have talked about the need for the region, about Afro, EMRO, and others. But I think if we do not do this together, we will continue to suffer from stockouts, poor quality medications, and also, which we do not want to do, wait in line to reach the medications that our patients need. So we hope to change the narrative. We hope to change the reality of our patients. And we want that reality to be that, first of all, they're healthy. Second of all, if they need a medicine or a medical product, they will get it on time without delay. Thank you very much for your attention.